Good evening, everyone. Welcome to today's event, monthly session with a doctor. I would like to request the President of Indian Social Club Sohar, Kondala Rajesh, to speak a few words.
Good evening, everybody, and happy Dasara to all of our members and non-members and those who are watching on YouTube. So, thank you very much for joining this program, especially for the ladies. And tomorrow is Oman Ladies' Day, but as for officially, we should not celebrating. That will be celebrated on later dates. But let me inform all that tomorrow is Oman Ladies Day, and on that occasion only we organized, but now we are not taking again we will have one more session with some other doctors and again with Dr. Preeti, and I welcome her on our board to give this presentation today, particularly for the ladies problem, and she is working as so many years here, and she worked in India also. On behalf of Indian Social Club and our executive committee, I welcome her and thank you very much. At the end, maybe I will announce some more events. So now I'll give to Sonali to continue the program. Thank you very much. Bye.
Thank you, Mr. Rajesh. I am Sonali Khare, General Secretary of Indian Social Club Sohar. On behalf of the Executive Committee of the club, I would like to welcome you all to today's event, monthly health webinar and open interaction with a doctor. The guest for today is Dr. Preeti Shukla. She hails from Kanpur, Uttar Pradesh. She has been practicing as a gynecologist for more than 25 years. Dr. Preeti worked in Mulchan Hospital, New Delhi and Max Hospital, Dehradun as a consultant gynecologist obstetrician. She has also worked in the Indian Air Force. She is currently working in Astar Al Rafa Hospital. Dr. Preeti is going to speak about women's health awareness. She will cover few important topics like menopause, gynecological cancers, protection to your kids, etc. Without taking any more of your time, I would like to request Dr. Preeti Shukla to take from here. Welcome, Dr. Preeti.
Thank you so much. I hope I'm audible. And I also welcome all the participants who have joined already. I can see a lot of many people here: Jayashri, Bhumika, Naz, Natasha, Neeta, Rujata, Sadaf, Shaila, Shanti, Siddharth, Srinidhi, and many others. Please forgive me, I've missed any names. Before taking much of your time, I would like to thank the Indian Social Club for giving such an honorable opportunity to me to speak upon women's health today. We have just finished with the festival of Navratri and we have celebrated womanhood. And I'm very happy that we are now sitting here and talking about women and the women issues. And we start with a very less talked topic, and that is menopause. I will share a PowerPoint presentation with you all, and I hope that it will be of much use to you all. So here we go. So here you see that there are ladies there and they are very confused. Some of them have got a clouded vision. Some of them are so anxious that they have lightning thoughts in the mind. And some people are just puzzled as to what is menopause. What is menopause? We all know that once we are 13 or 12 years of age, when we were young girls, we had the onset of puberty and we started with our periods. And that stage was known as menarche. And then we started having our regular periods every month, 4 or 5 days of bleeding. And then we had a reproductive life, we had children and other things. And then we came to most of the females who must be listening to this webinar. They must have come to their mid-cycle or the midlife. So now most of them, after going through the phase of life, they have come to a stage where they're approaching a stage where their reproductive life is going to come to an end. So when you are approaching this end of your reproductive life, when your periods are going to finish, or when they primarily finish, is the time which we called as menopause. So it's not clicking. So it's not clicking. Just a second, next slide. Yes. So how do you define actually? So it is not that today you had a period and tomorrow you did not have your period, the next month also you did not have your period, so you will say that you have gone into menopause. It's not that. It is when you did not have your periods for full 12 months, that is 1 year, no spotting, no bleeding. When for 12 months you do not have a single episode of bleeding, then only you say that you have gone into menopause. But before you go into menopause, your cycles are not the same as they used to be before. Sometimes they become irregular, sometimes it become more, sometimes they are just like spotting, and then 2 months they are there, 2 months they are not there. So it is an up and down, a roller coaster thing of a roller coaster drive with your periods. And this is what is known as climacteric. That is, it may be of 2 years, 3 years, 6 months, 2 months of duration before you finally reach to a stage when you don't have any periods at all. So this climacteric may be of many years. So the age at which you are going to have your natural menopause, which in short you can call ANM, age of natural menopause, ranges from 45 years to 52 years. In different regions of the globe, women achieve menopause at different age. In some countries, they have early menopause. In some countries, they have menopause at a later age, like 52, 53. This is how, but in Indian women generally have it around the age of 50 and 52 years. So this is the age at which you have menopause. So what are the symptoms? How do you come to know that you have entered into this phase of menopause? Then what happens actually, that it is your ovaries. You know that you have a uterus, you have 2 tubes and you have 2 ovaries. The ovaries are secreting certain hormones, and these hormones are chiefly estrogen and progesterone. It is the estrogen which is giving you the youth. It is taking care of the menstrual cycle. It affects the heart. It affects the bones. It affects the blood vessels. It has so many functions, believe me. And it also helps in the maturation of the follicles by which your eggs are produced. And then you go on to have pregnancies, and you have the regular cycles also because of the effect of estrogen and progesterone on the uterus. So this estrogen and progesterone, they play a unique balance game, and the whole reproductive cycle is maintained throughout your 35, 40 years of reproductive life. What happens when there is an aging of the ovary? These hormones are not produced, or they are produced in a lesser quantity. Now, believe me, this ovary is not the only structure which is producing estrogen in your body. There are other structures also which produce a little bit of estrogen. And what are those structures? You have the adrenal gland also. Adrenal glands are another set of endocrine glands which are sitting on your kidneys. They also secrete a little bit of estrogens along with other steroids, androgens and cholesterol, and so pregnenolone and so many other things. Then you have fat in your body, the peripheral fat and the visceral fat, the fat that has been deposited by your eating. So many years of eating, the extra fat, the extra glucose has been converted into glycogen, converted into fat and stored. So this fat also acts like an endocrine gland. And as and when required, this will also act upon the pituitary axis, the hypothalamus, and help and gets converted into testosterone and gets converted into estrogen, that is another form of a estrogen hormone, and converts into estrogen. So what I'm talking about is that ovary is not the only organ which is producing the estrogen, but it is the only organ which is producing estrogen in a large amount. So when the ovary has aged, when the follicles have finished, the FSH and LH hormones have decreasing, they're decreasing, the ovaries are not responding, then the estrogen hormone is very less. As a result of the decreasing hormones, you have these symptoms. And what are these symptoms? You have hot flushes, you have mood swings, you have cold sweats, you have lack of sexual desire, there is vaginal dryness, you have muscle weakness, you have urogenital atrophy, as a result of which you have dryness, itching, you have recurrent infections, you have recurrent UTIs, there is atrophy of the structures, the skin becomes dry and shriveled, there's a decrease in the bone density, there is osteoporosis, because estrogen has got a positive effect in the calcium accumulation in the bones, as a result of which your bones become fragile. And even if you have a gentle fall, a normal person wouldn't have a fracture, but a menopausal woman will have a fracture. And this is known as a fragility fractures. So your bone density becomes less. Then most of the menopausal women, because of these hot flushes and cold sweats and vasomotor changes and this itching and anxiety, they generally suffer from sleeplessness, that is insomnia, they have anxiety, and they have depression. So you see, the entire mechanism, the entire nature of the woman changes during menopause. They will cry for no reason. They will not be very happy. They will not like to talk with people. They will get irritated on small things. They would like to sit alone in some room. They would like, suddenly they will wake up in the night. They will feel as if somebody is compressing their chest. Then suddenly they will feel that they are feeling very hot. They want the AC to be on. Then they will feel suffocated. They want to open the windows. They want to go out. They're irritated. They don't want to talk to their husband. They are irritated. They don't want to have any sexual activity. There's lack of libido. So all these things are there. So people think that, oh my God, it is a very difficult time. She's becoming a difficult person. The family doesn't understand. There are many issues. People misunderstand, and there are arguments, and then with the arguments and all, the home atmosphere gets disturbed and the lady becomes more depressed. Plus, this is the age, 45 years and 52 years, when so many other things are also happening in life. The children have grown up and they have left the house. Either they have gone to university, they have gone to hostel, they've left the house, the girls have got married or something like that. And you are alone in the house. There's an empty nest syndrome, you feel lonely. And suddenly you realize that all life, what have you done? You have not done anything for yourself. This is the realization that you get. And more these realizations, the more you get depressed, nobody's understanding you. So this is what happens in menopause. You become more sensitive, you become more anxious, you become more perturbed, and you don't know the reason why. So to combat these things, all these symptoms that I've enumerated, what all things that you can do to combat these things? Firstly, people should talk about it. You should tell your partner, you should tell your children, your spouse that you are going through this phase. And if you have any problem, you should discuss with your doctor, your gynecologist, or anybody else, so that you have somebody to confide in and you go for some medical help if you require. So what are the things that you can do? It has been seen that people who are active or who do exercises, who are socially active, who do walkings or evening walks, who go out, who have hobbies, they suffer less of menopausal symptoms. So if you have not been active, you have not been exercising, you do not have any hobbies to follow, or you don't keep yourself busy, this is a time that you should go for lifestyle modifications. You should manage yourself and your time, and you should see more options of how you can make yourself busy and more productive, and discover yourself, the things that you wanted to do earlier in life. Find it out. Where else can you do it? Any game you wanted to play, any badminton, any squash, any table tennis, you wanted to dance, you wanted to paint, try to do all these things. Then you start exercising. And it is the low impact aerobic exercises that you should do. It is not the heavy impact exercises, because it is going to do you more harm than any benefit, because your bones are weak and you may injure yourself, or your heart may not be able to take so much of exercise. So you should do low impact aerobic exercise. By low impact aerobic exercise like yoga, simple exercises, or simple brisk walking, or you can do swimming. Swimming is an overall exercise for women, which doesn't need a lot of energy, and it is a complete exercise in itself. Then if you are fond of caffeine, coffee and tea, you should reduce that. If you are fond of social drinking, you should reduce your alcohol, because all of this will aggravate your situation, aggravate your menopausal symptoms. Then for your vaginal dryness, there are many lubricants which are available now. These are the bioadhesive polymers of polycarbophyll. They adhere to the vaginal mucosa and they absorb water, and they retain it for a few days. So you don't have to apply it again and again. So you can use these vaginal moisturizer. They will help you in keeping your vagina moist. Plus, you can retort to a little hormonal treatment like estrogen creams and all, which will keep your vagina, moist and neovascularized and keep it healthy. Then there are certain food, cereals and all, which you can add in your diet to improve your intake of phytoestrogens. Phytoestrogens are the estrogens which are present in the plant products. Phyto means plant, and estrogen is the estrogen hormone that we know. It is the game player. So what are these phytoestrogens? They are present in soya bean, it is present in soya nuggets, it is present in soya milk. Flax seeds, oil seeds are rich in lignans, which also have rich in phytoestrogens. Example of Japanese, all Japanese women you must have seen, they have such nice skin, they have shiny skin, they look young, and they have strong bodies because their food consists of all these things. They are eating seafood, and they're eating seafood. They have, they have lignans, and they have seafood on they have fungus mushrooms, which are rich in phytoestrogens. Other phytoestrogens you can find in flowers product like red clover and black cohosh. I do not know the Indian names. They are more common in North America and South America, and their capsules are available in the market. That is extract of red clover and black cohosh, Saint Watts, and ginseng. You must have heard about ginseng. This is also used to increase and take care of the more motor symptoms of menopause. Then vitamin E and vitamin C supplements. You can start taking these supplements because it has been seen that they reduce your hot flushes. Then if you're suffering from too much of depression and these things are not taking care of your depression or your anxiety, you can take medicines. And you have antidepressants, which are SSRIs and SNRIs. You do not need the details. You can take those with the help of a doctor. He or she will advise you, and you can take it. And one of the most important and very popular medicine these days is venlafaxine. But venlafaxine should not be taken by patients who are already suffering from endometrial cancer or breast cancer, or who are taking tamoxifen. Just remember, those patients should not take venlafaxine as an antidepressant. The rest of everybody can take venlafaxine in menopause. Then you have ordinary interventions like hormone replacement therapy. In hormone replacement therapy, we simply take the hormone, just like in thyroid disorder. When your thyroid is not proper, you take eltroxin hormone orally. Similarly, if the estrogen is not there, you take estrogen orally or transdermally. Locally, you can take estrogen, but you should not take unopposed estrogen if you have a uterus. If your uterus has already been removed, then also you will have vasomotor symptoms because your ovary function has been stopped. Okay, your periods have stopped, but the ovary hormones have stopped, so you will have vasomotor symptoms. So, but the negative effect of estrogen on the uterus will not be there. So you can take estrogen without the protection of the progesterone. But if you have a uterus already, you have not had a hysterectomy done, then you should take progesterone along with estrogen. Now I will tell you what. Estrogen alone is a harmful hormone. It will cause hyperplasia of the endometrium. But if you take progesterone along with it, then progesterone is anti-estrogen and it will protect your organs against the negative effect of estrogen. So always when you have an intact uterus, you should always have little bit of progesterone at the end of the cycle. For 20 days, suppose you're having estrogen alone, then last 10 days you should have progesterone. So estrogen and progesterone combination tablets you can take as a charti. But this combination is not the same like oral contraceptive pill. It is different. Hormone replacement therapy is different from oral contraceptive pills. So they are not a substitute to each other. Then we have alternate therapies. All of you are very fond of homeopathy, Ayurvedic, acupuncture, and Chinese medicine. So you have magnetic therapy is there. Then so many reflexology has come. So there are so many alternate therapies, massages, and so many things are there, magnetic therapy. So you can always take those therapies. There is no contraindication. But in homeopathy and Ayurvedic, you don't know the drugs or the jari, booty, whatever has been used. What are their counter effects? What are their side effects? We are not sure of that, but there is no harm in taking it if you are getting benefited. but you should take it from safe quarters. You should be sure of what you're taking. So this is all that I could tell you about menopause. And one more thing that I wanted to tell you about that the thing is that it is at menopause, generally you will tend to see that you are gaining weight. And it is seen that as you age, there is a 0.5 kg weight gain every year. So if you're not exercising and if you're not working and if you're not burning the fat that you've already accumulated over the years, then you're going to gain that weight. And if you gain that weight, the extra food that you're eating, which you're not burning, will get accumulated in the form of fat. And that fat will get converted into estrogen. And that estrogen will then act as a negative hormone and affect on the existing uterus and breast, and will act to land you into some other condition, which I'm going to talk about later on, that is cancers of the other gynecological structures. So you have to be very careful. You have to control your obesity and your weight gain, especially at and after menopause. Other thing that you have to control during menopause is your blood sugar, because this is a time when most of your metabolism will be deranged. And you have to check your metabolism. You have to keep your metabolism in check. And so you have to keep your blood sugars normal, because these both the things go hand in hand, obesity and diabetes. And obesity will give rise to diabetes. So obesity and diabetes, both you have to fight during menopause if you want to have a healthy old age. This is in short that I wanted to talk about menopause. And these menopausal symptoms, if somebody asked, how long will they last? So it depends. For some women, it may not occur at all. They will say, oh, nothing happened to me. I had a menopause. I never came to know anything. Some women will say, I had terrible time. It existed for 6 months, 8 months. Some will say for 1 year, full 1 year, I had a problem. For 2 years, I had a problem. And it is like that. It depends upon you and your genetic makeup, how your mother suffered, how your aunt suffered, how your sister suffered. And the age at which you get menopause is also determined by your genetic makeup and by your family tree, how your family women have had similar pattern you will have. So this is all that I wanted to tell you about menopause. If any questions, you please message me. I will be happy to answer about menopause. Coming next to a very ghastly topic, I should say, gynecological cancers. It is actually, I wanted to keep a picture of a crab, but I didn't want, because crab is still a very cute animal, I feel, and cancers are really very dreadful. But we should not be afraid of cancers. We should know what we are talking about, and we should not be afraid of it, because we should know what we can have and how we can prevent it, or how we can fight it, so that we are ready to face it. So firstly, I would like to tell you that what are the gynecological structures and what is actually cancer? What is cancer? What do you think? What is cancer? Cancer is something which is a growth of any tissue, any cell, haphazardly in an uncontrolled way. It can be of anything. It can be of blood, it can be of skin cells, it can be of bone cell, it can be of any other tissue like uterus, it could be of prostate, it could be of pancreas, it could be of gallbladder, it could be of anything. Any structure, any organ can just touch any particular cell. It could be a cartilage, it could be a bone, it could be a squamous cell, it could be an adeno gland, it could be a secretory gland. It can start developing fast due to some reason. And that reason could be something. It could be a trauma, it could be a toxin, it could be genes, it could be a mutation. So it starts replicating, it's like a virus, it's a virus of a computer, starts replicating, and then it is out of control. And anything which is growing, it needs energy, it needs food. So it will start taking the energy of your body, it will start taking the nutrition of the body, it will take away the oxygen of your body for its own growth, and the other normal structures will suffer. This is what happens in cancers. Therefore, the cancer grows and you become small. This is what happens. So it can affect any part of the body at any time, and it can be due to many factors. So let us talk about it. So cancer, as you all know, is a uncontrolled growth of any particular tissue or a cell. And there are many factors which will cause this. It's environmental factors. What are the environmental factors? Like there's a Hiroshima bomb, you've already heard that there was bomb explosion, as a result of which so many disabled and so many babies were born with so many disabilities and congenital anomalies and so many cancers. Then there could be other things. There could be radiations of other sorts, not only because of the nuclear power. There could be other environmental factors like pollution, like plastic, like we are eating food on plastic plates, we are getting food in plastic bags. This itself is causing a lot of carcinogenic changes. Then we have a genetic susceptibility, like there can be some genes which have gone wrong in a body, or we got some genes from our ancestors which are susceptible to some cancers, colonic cancers, gastric cancers, pancreatic cancers, or other cancers of the body. Epigenetic changes. Epigenetic changes are changes which have been brought about in the laboratory, and so many things are being done, so many researches and all, due to some changes, or due to IVF, we have IVF children, or something has been done, some changes, and as a result of which there have been some carcinogenic changes and a cancer has developed. Then we have altered metabolic states, like I've already talked about obesity and I've talked about diabetes, which are the precursors of causing an altered environment in which the cancer will love to grow. It is getting sugar, it is getting fat, it is getting all the nutrition, and it's getting oxygen because we are breathing oxygen, so it is growing. The cells are getting full-fledged nutrition, so they are growing. So this is the factors which are causing cancer, uncontrolled growth. So till now, many people I'm sure would not be knowing, or maybe most of you would be knowing what cancer is. So when eye sees what the mind knoweth, so we will only see in our body the symptoms only when we know that they are the symptoms. If we don't know that whatever we are suffering is something serious, we will never feel that it is something which we worried about. So we should know what are the things what are the sinister signs which will direct us to think that maybe something is wrong in my body. So you should keep your mind open, and you should read, and you should hear, and you should have a proper understanding about your body, so that how your body reacts to certain things and how it should. Then prevention is always better than cure for everything. But is cancer preventable? In a way, in some ways, cancer can be prevented by having a healthy lifestyle, by maintaining your sugars and obesity and doing good exercise, not taking bad things, not taking drugs, not smoking, not having too much of alcohol, protecting yourself from too much of radiations which you get from CT scans and unnecessary radiations by going into nuclear fields, and not getting enough protections when you're going into where x-rays and things are being done, or the people who are working in lab technicians and all who are working in x-ray labs and all, not taking enough protection, or nuclear plants, people who are working in nuclear plants, things like that, or scientists who are working there. So they should take proper precautions. But cancer, if it has to happen, will happen. But it is always better to know what are the risk factors so that you delay the onset of cancer. And if it does happen, you should diagnose it early so that you put the treatment early and reduce the severity and improve the prognosis and improve the survival rate. So this is what the talk is all about, to tell you all, friends and ladies, that what are the things that you should be worried of and you should not be worried of. Because you should be cautious and you should be aware, but you should not become hypochondriac. You should not think that everything is going to happen to you, but you should know that what could happen. So what are the general signs of any cancer? Let us talk not of particular cancer. Any cancer happens to you, whether it is a cancer of the tongue, whether it is a cancer of the brain, or cancer of the lungs, or blood cancer, or bone cancer, or any other cancer. What are the things, as I told you, that cancer is eating away your whole nourishment. It is eating away all your things. It is taking all the oxygen. It is taking all the things. So there will be a loss of weight. It will take space also. It will grow in size. It will take space. It will push your intestines, and it will cause difficulty in breathing. And if it invades, it will cause unnecessary pressure changes. It will cause unnecessary bleeding and hemorrhage. And the breakdown products will put a load on the liver, and therefore you will have jaundice. So you have loss of weight, you have loss of appetite, you have pallor, you have jaundice, you have abdominal distension, you have pain, you have burning micturition, you have diarrhea. Burning micturition means that you have burning while you pass urine. We have headache, vomitings, undue natural bleeding. You have bad smelling vaginal discharges, bone pain, and fractures. So these are the general signs of any cancer. So when are we talking about women? So let us talk about the targeted organs where we can have cancer. So we can have cancer on the breast, uterus, cervix, ovary, vagina, and vulva. These are the female. Breast comes into the domain of the surgeons, but it is basically an organ, female accessory organ, although it is present in males also, and males also suffer from breast cancer. But I'm specifically talking about breast because females firstly feel very shy to discuss about the breast issues to male surgeons. They generally prefer to go to female surgeons. And first person that they come to with any of their breast problem is a gynecologist or a female medical officer. So, and cancer is something that everybody is worried about, and especially breast cancer, because everybody is now aware that breast cancer is on the rise and it can happen to anyone, anytime. And it is very difficult to diagnose at time. Sometimes it is diagnosed at a very late stage. Therefore, everybody wants to know about it. So I have put this in this list, not to annoy any of my surgeons. So the breast is there, the uterus is there, the cervix, ovary, vagina, and the vulva. I will not discuss much about vagina and vulva because it is a sort of a skin cancer. We will discuss some other time, but the rest of the organs we will discuss today in short, not in details because it will be too ghastly and too elaborative for me to cover. So let us talk about the breast. So breast, is the mammary glands of our body, and they are chiefly utilized in feeding our babies. They are the milk producing glands of the body. They are a modified sweat glands, and they are 2 in number, and they basically have a nipple and an areola, and chiefly they are made up of fat and milk ducts which open into the nipple, and they are fibrous structures which divided into few lobules, and they're placed on a muscle, and with the help of a fibrous band, they are attached to the axilla. They are drained by blood and veins, and there are lymph which sieves the blood, and there are a lot of lymph nodes in the axilla and the clavicular area which drains the breast. Okay, so whatever infection happens in the breast is sieve, a chunni, it filters the lymph nodes, they filter the infection. When they filter, they become large. This small enlargement of the lymph nodes is due to inflammation or infection, which will be over if you take antibiotics or anti-inflammatory drugs. But if it is a cancer, then they will be hard and they will be fixed and they will be big and they will be palpable and they'll be painful. So if you have any nodule or any swelling in the axilla, which is painful and fixed and maybe ulcerative also, fungating, it is breast cancer. Then basically breast is generally made up of milk ducts or ductules and fat and skin and nipple. So generally you have either cancer of the fat will transform, or the ducts will change into cancer, and you have duct ectasia, and you have round fibrous structures, which is known as fibroadenoma. These fibroadenoma are mostly benign in nature. Benign means they are not malignant. They are not real tumors. They are tumors because they are big in size and they may increase also, but they are non-painful, they are mobile, and they generally don't become typically cancerous. So they can be, if they are not increasing in size and they are not painful, they can be left behind, but it is always better to have them removed and get it examined and histologically confirmed that it is not a malignant tissue. So even if you have 1 or 2 fibroadenomas, it is better to have it removed. and so that you are mentally free, that it is not a cancer. Otherwise, you'll keep suffering that I have two fibroid-like structures in my breast. Is it cancer? Is it cancer? Better to remove it, because you never know when anything wrong can happen with you. But at a younger age, when you are young, less than 30 years of age, fibroadenomas, 80% of the chance, 80% of the times they are benign. And when you are old, 80% of the chance they will be malignant. That is, if you're 60 years and above, it is definitely going to be malignant. So depending on your age and your presentation, these benign looking small breast mouse, they are known as, because they're mobile and they're soft and they're non-painful, they should be taken care of if they are at a later ages. So this was a picture of the breast, which I just wanted to tell you that how it looks like. So if you have, you should take a family history, because it runs in the family. Some of the breast cancer runs in the family, and there's a certain genes which are known as BRCA genes, BRCA genes, BRCA genes. There are two types of genes, BRCA1 and BRCA2, and both of them are associated with breast as well as ovarian cancers. If any one of your family has this cancer, you should keep it in mind that you also can suffer. Then you should always do self-examination of the breast from the age of 20 years. And if any doubt, you should go to your doctor. You should do a routine mammogram and ultrasound from 20 years or 35 years of age, and better to do 40 years and above. If there is any lump or swelling, you should definitely go and show. You should do an ultrasound, do a mammogram, do an FNAC, fine needle aspiration cytology. If any doubts, do an MRI, and then take a surgical opinion, get it removed, get a histological examination, and then follow according to the examination, histopathological examination report, do it the treatment. Either it could be chemo or whatever. If you have a discharge from the nipples, which is bloody in nature, then it is more dangerous, because it shows that you have duct ectasia or duct carcinoma. So you should go. If it is a milky secretion, it is galactorrhea, then it is a hormonal disorder due to the increase of prolactin hormone, and then also you should meet the doctor. Any swelling in the axilla, as I only showed, it could be a lymph node swelling, you should so. One more thing I wanted to say. When the breast is developing in the womb of the baby, when the breasts are being formed, then it is a line of breast tissue which is formed. Just like in animals, you see, some animals like dogs and all, there are so many multiple nipples they have, multiple breast tissues they have. Humans also have multiple breast tissues which become vestigial, they go away. But one or two extra breast tissues may remain. Sometimes vestigial breast tissue may also be present in a axilla, which may appear as a lymph node, but they are actually breast tissues. So you should get it examined and histopathologically confirmed. Sometimes cancer may develop in those breast tissues also. So this is what I wanted to say, that sometimes breast tissues may also be present. I've already mentioned all this, that you should do ultrasound, mammogram, fine needle aspiration cytology, MRI, excisional biopsy, follow-up, and further treatment with chemotherapy or radiotherapy. Chemotherapy or radiotherapy, a word about it, that chemotherapy uses chemical agents, medicines, to finish off this rapidly growing cancer cells. Because it is these chemical agents will kill those rapidly growing cells. And radiotherapy uses the X-rays and radiations to kill these rapidly growing cells. That is radiotherapy. Some tumors are chemosensitive, some tumors are radiosensitive, that your report will tell. This also I've mentioned, then below 30 years, 80% of the breast lumps are benign. After 60 years, most of them are malignant. Some of the breast cancers are hormone sensitive. This is very important, that some of the breast cancers are estrogen receptor positive and some of them are progesterone receptor positive. And you should know what type of cancer you are suffering from, so that you don't take that hormone. Otherwise, you will have breast cancer or chances of. So how can you keep the breast cancer at bay? Breastfeeding goes a long way in prevention of breast cancer. So you should tell your friends or your daughters or your family members that if they are pregnant, they should always go for prolonged period of breastfeeding, because it goes a long way in protecting against breast cancer. They should avoid exposure to radiations, prevent from getting obese, keep your blood sugar normal, prevent prolonged use of hormones. And if you have a history of breast cancer in your family, you should go for a risk reducing surgery. That is, you should remove your ovaries, and you should also remove your tubes, because tubes are responsible for ovarian cords. You should remove your tubes and ovaries once you have completed your family. This is called a risk reducing surgery. And also you can use, once you have completed your family, you can also use GnRH. That is sort of chemical oophorectomy, GnRH, for preventing recurrences. A little picture, what else is there in the human structure? In this diagram, you see there is a vagina, up you have the uterus in the center, in front you have the bladder, and in the behind you have the rectum. You just see the diagram. So if there is any cancer in the vagina, any cancer in the cervix, which is the mouth of the uterus, any cancer in the uterus, it will be spreading to the bladder ahead and to the intestines behind. Any cancer in the vagina will go up to the uterus. Any cancer of the uterus will come down to the vagina and the cervix. So this is how cancer spreads. And if all the structures will get affected. So you will have difficulty in passing stools, you have difficulty in passing urine, you will have a lot of bleeding. This is what will happen in the cancers of uterus, vagina. So in the cancers of uterus and vagina, you have mixed symptoms of other diseases also. Plus you have bone pain and other problems also. The only structure which is not down below is the ovaries. Ovaries is in the abdomen, it is inside. You see, it is inside. So ovaries, when they become carcinomatous, they will start growing and they will affect the abdomen. And then abdomen will increase in size. There will be collection of fluid and abdomen will become big. You have abdominal distension, the intestines, the omentum will be affected. The abdominal organs will be affected. The presentation will be different. So uterine cancer is a disease of perimenopause, around 55 to 60 years. It is generally those people who have never been pregnant. Like, nuns. Nuns generally, they are more prone to have uterine cancers. And those women who do not have menopause in time, they also become more prone to uterine cancer because they are exposed to estrogen for a longer time. And they have more bleeding and abdominal swelling. And the treatment depends on the stage. Basically, it means removal of the uterus and the extending structures. If the surgery cannot be done, if there's adhesions or it has spread to the adjacent organs, as I showed in the diagram, you cannot do surgery, then you have to do chemotherapy and radiotherapy. How to prevent uterine cancer? You should not take hormones for a long time. You should not have prolonged amenorrhea for a long time. And you should use oral contraceptive pills to give protection against it. Oral contraceptive pills are said to be protective against uterine cancer. Then we come to cervical cancer, which is very important. Only now breast cancer is running ahead. Earlier, it was the cervical cancer which was killing people, killing women all over the world. Now breast cancer is running ahead. So the mouth of the uterus is called the cervix, and it is exposed to the environment. So how does carcinoma cervix happen? It happens with more sexual activity. The more sexual activity is there, it is exposed to more viruses, sexually transmitted diseases, human papilloma virus, herpes virus, and that is a precursor of cancer of cervix. So this is entirely different pathogen, HPV. And because it is easily seen, and pap smear can easily be taken by the cervix. When you come to any gynecologist, they can easily see with the help of a pap smear the cervix. They can take the test and they will come to know. We can even take a smear and send for HPV PCR, and we can check whether HPV infection is there or not. So this diagram shows you how the uterus is there, and the end of the uterus is called the cervix, and you can see a small growth cancer growing there. This is how the abdomen looks with the uterus and cervix. There's a cancer and it has spread to the lymph nodes along the blood vessels of the abdomen. It has gone here and there. So whole cancer has spread. Very bad picture, but you can see. This is how a gynecologist will look at your cervix. This round thing is the cervix. And with the speculum they are seeing, and this dirty looking red thing that you see is not healthy. This is healthy tissue and this is cancer. And we can confirm it by staining it with iodine and by acetic acid. We can stain it and we can see if it turns white. Then we take a biopsy from here, there, and in the lab, it's in the OPD itself, we can take a sometimes biopsy. Otherwise, we can do it in the GA, and we can see whether cancer cells are present or not. So it is so simple to catch a cancer of cervix. So you all should not be afraid of getting yourself examined. It is very simple. It is not at all painful. Only we have to open with an instrument, which is a speculum, and we can see the cervix. It is there. You know, you all have become mothers. You know, your baby has come out from here. The cervix opens, the baby comes out from here. It becomes small like this. So this is how the cervix look. So what are the features of cervical cancer? We have bad smelling, copious discharge, not simple bad smelling, which you suffer sometimes. It is very dirty, you know, like a dead rat type of a smell. And there is, whenever you have any sexual relation, you will have bleeding, fresh red colored bleeding, which will not stop. Then you'll have pain during having sexual contact. Otherwise, also you will have pain. You have urinary symptoms, dysuria, burning in urine, difficulty in passing urine, defecation, like I showed you in that diagram. Behind is the bowels, in front is the bladder, in between is the uterus, and the vagina and the cervix. So you will have all these symptoms. So how do you treat it? You see the cancer is there sitting in the cervix. So you remove the cancer. So how do you remove it? You remove by cutting it out, by conization, or by burning it, by fulguration, or by removing it with laser, by loop laser excision, or doing a hysterectomy, removing the entire uterus. If it is inoperable, you do radiotherapy or chemotherapy, or you do a combined therapy. You do both the things, radiotherapy and chemotherapy, depending upon the stage of the cancer. Then how are you going to protect your children from getting cervical cancer? This is something which has come into practice and people are following it, and you all also should do. You all know that cervical cancer is caused by sexual relationship. Basically, it is 70% of all the cancers are due to human papillomavirus and herpes virus. There are many strains, 16, 18, 13, 11 are the most notorious ones which cause cancer. So we have two types of vaccine, Cervarix and Gardasil, which give protection against 2 and 4 types of HPV viruses. 3 doses are given at an interval of 0, 1, and 6 months. And they give protection against, Cervarix gives protection against 16 and 18. So this is given, this dose you can give to your children. Now, this vaccine should be given before you have been exposed to any sexual transmitted disease. So before you have had your first intercourse, that is the best time to give your vaccine. But if any female has not got this vaccine or did not know about this vaccine, they can take this vaccine at any time before 26 years, starting from 26 years to 35 years of age. It can even be taken at 45 years of age to give you protection, but best it is to give in teenagers 12 to 13 years of age. So this is a vaccine which has come for cancer cervix, which you all should know. The standard norms to follow to prevent cervical cancer: please avoid unprotected sexual activity. Please use condoms, do a barrier method. You have regular cervical screening, that is pap smear from 25 years onwards, or whenever you start having your sexual life. You should not disturb the normal vaginal flora. You should not do vaginal douching or washing or apply things inside the vagina, perfumes and things like that. You should not do, because your original lactobacillus is getting disturbed, and they are the good bacteria which maintain the health of the vagina. They maintain the pH of the vagina that is disturbed. So you should not even wash with water too much, because that will also disturb the pH and then expose the vagina to the pathological bacteria and fungi. Ovarian cancer. Yes, now we come to the ovaries, which are typically different. Ovaries are very notorious, and maximum deaths are also due to the ovarian cancers all over the world, because they are also like breast cancer, sometimes diagnosed late. That is the reason. Most of the deaths in women worldwide are due to ovarian cancers. They are the key organs, because the other organs which are producing the hormones and the eggs, so many structures, there are sex cord cell, there are germ cell, there is stroma, and there is the capsule, and there are the Sertoli cells, Leydig cells. So many cells are there, and all of them will grow uncontrollably to form different types of cancers. So about so many types, classification is there, which I don't need to tell because you wouldn't understand. So ovarian tumors can be followed by tumor markers because they are hormones. So we can measure hormones and we can see whether we have tumors, or if we already have a tumor, we can see whether the tumor has regressed in size or increased in size by measuring these hormones. This picture shows how a ovarian tumor looks like. So much distension. It looks like a full month, 9-month pregnant patient. So much abdominal distension, so much fluid collection. Ovary must also have increased to a size of maybe 25-30 centimeter, with fluid in the abdomen, with omentum getting stuck, with intestines becoming stuck, and the patient having breathlessness, pallor. Just imagine the patient is thin and the whole abdomen is so big. So the ovarian tumor presents with abdominal distension, pain, ascites, cachexia, menstrual disorders, additional features like hirsutism, all hormonal changes. Tumor markers which can be used for ovarian tumors are CA125, CEA, beta-HCG, alpha-fetoprotein, LDH, just to name, just so that you know. Ultrasound is an important modality, very simple. Ultrasound to diagnose small ovarian cyst to a big ovarian tumor can be easily diagnosed by an ultrasound. And ultrasound features can also differentiate between a benign and a malignant cyst. However, CT and MRI and PET scan can also be used for more specification. The treatment of ovarian cancer is surgical. We remove the tumor, we remove the attached omentum, whatever has been sticking to the tumor as much as we can, and follow up with chemotherapy. And we follow up with CA125 and other hormones to see whether it is regressing. How can we prevent ovarian cancer? By preventing exposure to asbestos and talcum. It is said that talcum causes ovarian tumor. So you should not use too much of talcum, and industries of asbestos, you should well protect yourself. Generally, women don't work in asbestos industries, but still prevent yourself exposure. Then reduce the use of ovulation induction. Those who are very fond of having clomiphene citrate to have twin pregnancies, they should not do it, because more you disturb the ovary, more you puncture the ovary, the more ovarian insult, the more cause of cancers. Then oral contraceptive pills render protection against ovarian cancer. So pills are very good. If you think of family planning, contraceptive pills will give you protection against endometrial cancer also and ovarian cancer also. So you know now that oral pills are very good for you. They are not bad. You will increase weight 1 or 2 kg, but you will not have cancer. Then the vulval cancers are just like skin cancers. They will present like itching, ulcers, velvety growths, distortion of anatomy and things like that. You will come to know that something is not normal in your skin down there. And this is how it will present. And it is treated locally with help of creams, also surgically by excision of the skin and other structures. It is diagnosed by biopsies, but they are the rarest of all tumors, and they generally present in old ages. The take-home message, that estrogen hormone is the key player in most gynae pathologies. Obesity is the next dynamic endocrine organ, because adipose pituitary axis continues to work even when ovaries have stopped working. Being obese does not make you more estrogen rich, but more insulin resistant. Now, some women say that if I am fat, the fat will get converted into estrogen, so I will remain young for a longer time. No, no, no. You will not remain young for a longer time. You will have more problem, because you will be prone for more diabetes. You will be prone for more disturbance of your cardiovascular system. So you should control obesity to control midlife crisis. Fat and sugar are two controllable factors to fight against cancers. So let's fight cancer together. Thank you so much. Any questions? I'll be very happy. I already received one or two questions. I will try to answer. First, I'll go back. I will finish my PowerPoint. Okay. So HPV vaccine, they are saying. So we have the Cervarix vaccine, which is available in Oman. And if you want this vaccine, it is available. You can get it. So it is the HPV vaccine only, Cervarix. It gives protection against 16 and 18 strain. Gardasil also may be available in some places, but I have not seen it. It gives protection against 4. So you can get it. Can you hear me? I don't know who asked this question. I will not take your name, but it is available. And as I told you, it is best given to the teenagers. But if you want protection, you can also take it, provided you've already not got any other herpes or human papillomavirus infection before. Any other question? Somebody had already asked me about fibroadenomas. I've tried to answer that question. I hope they've got their reply. Yes, it is available in Sohar. This Cervarix is available in a hospital also. In Astor also it is available. If you want, you can come and take it. Okay. Okay, if you want to speak to me, you can speak to me. I will, you can unmute and ask directly without, I mean, if you are bold enough to talk.
Ma'am.
Yes.
This actually, I wanted to take, my age is 53 right now.
Okay.
So it is necessary to take this vaccination?
See, already your reproductive life is over. Okay. So already whatever infection you would have got in your sexual life, you would have already received it, Nana. Okay.
Yes,
so I think for you taking a vaccine at this time will not be very fruitful. But more of a concern is that your menses should have stopped.
I don't have a uterus, ma'am. It is already removed.
Uterus has been removed, then it is, see, you do not have the issue of carcinoma cervix, no?
Okay.
Your cervix is not there. So it is generally, HPV generally causes carcinoma cervix.
Okay. And it is necessary to take for my daughters?
Yes, yes. For your daughters, it will be a boon if you take a protection for carcinoma cervix, especially if they are not married. If they are not yet.
Sorry, ma'am. Please continue.
Yeah, because if they are not married and they have not got exposed to any sexual relation, so they have not been exposed to any sexual infection. So it is the best time to get protection because, you know, and you should, I think as mothers, we should always train our children and our daughters especially that they should not have any unprotective experience, because you never know. There are so many types of infections they can catch these days. And because the life is becoming so forward and people are using recreational drugs and so many things. So good, proper education should be given to all the daughters.
Yes, ma'am. Ma'am, one more thing I wanted to ask. My daughter has already taken 2 vaccines of HPV. She's right now in Hamburg, and she's coming for Diwali here, and she has taken 20 days back the 2nd vaccine. So it is possible for her to take the 3rd vaccine within 1 month?
No use of taking it within 1 month. See, first should be given within 1 month, and the 3rd should be given after 6 months. Some few years back, we were giving only 2, but now we are giving 0, 1, and 6. 0 month, 1 month, and 6 months.
Okay.
Some years back, only 2 only, 0 and 1. But now,
okay, this 6 months gap should be between the 1st vaccine and the 3rd vaccine?
Yes, 0, 1, and 6.
Okay, so this is the after the 2nd vaccine. After 1.5 month or 1 month.
5 months. After 5 months, she can take after 5 months. Yes.
Yeah. Okay. Okay, ma'am. Okay, ma'am. Thank you so much. Thank you. Nice to speak. Thank you.
I hope it was good.
Yes, it was very good. So much knowledge we have got. Actually, we were 0 about this, and it is very benefit to everybody. Actually, I was very late to on the this one. I forgot, And I'll
You can-
pass on our messages to everybody. Means,
Thank you. You can see on the YouTube, I think it will be there. So you can again see it. And
Okay.
keep asking if any queries, my number is there. You can just,
Okay,
I will be very happy and I will be too happy. This is something which I have done out of my own interest. Whatever
ma'am.
little I could help people, because these topics are generally not discussed, but it should be discussed actually.
Yes, ma'am. Thank you. Thank you so much.
Most welcome.
If anyone wants to ask a question, they can unmute themselves and ask the doctor. Even
Hello.
later also, you can send a message to her and talk to her.
Hello, Dr. Preeti. I want to ask.
Hello. Okay.
Yeah, yeah. You said no mammography. So there is any exposure to radiation like that for that? Means
Yes.
routinely.
See, there, see, any x-rays, it is mammography is a specialized x-ray only, but it has radiation, but that radiation is not that great that it will cause cancer. You understand?
Okay. And
It is not.
also, okay. And you said OC pills prevent cancer, like protection. So, but if
Yes.
hypertension is there, then there is risk, no?
No, there is, see, when we talk about oral contraceptive pills, we have to see the medical history. There are certain women who are suffering from migraine or who are suffering from epilepsy, or there are certain women who are already taking some anti-epileptic drugs or some enzyme inducer drugs. And those we try not to give oral contraceptive pills because the efficacy is changed, or their convulsions will increase, something like that. But in hypertensive patient also, it is not that they are contraindicated. We have to see the pros and the cons. Okay. And these days, the oral contraceptive pills are very low dose. They are not very high dose.
Okay.
So oral contraceptive pills can, these days, many types of pills have come with very low dose estrogen and progesterone combination, which can be used. But it depends on what type of hypertension you are having, or what level of hypertension you are having, and what antihypertensives you're taking. It is not that bad that you can, if for a short term, if you're taking, for example, 1 year or 2 year, it is not going to harm you. Sometimes oral contraceptive pills may cause some adverse effects, but it is on a long term use. Like if you are having breast cancer, like I said, they are hormone positive. Sometimes they are estrogen receptor positive, sometimes they are progesterone. So if you are taking OCPs, you are harming yourself, because you're taking OCP, it has got estrogen and progesterone both, and you don't know whether you are having carcinoma breast or going to have carcinoma breast. So you're taking OCP, and there's a moderate risk of having carcinoma breast. Okay. But it is only on a long-term use. Understand? That is more than 5 years. More than 5 years. I don't think so anybody would be using OCPs for more than 5 years. And OCP, if you take only for 1 year also, then it will give you 10 years of protection. You understand? After leaving, if suppose you take for 1 year one OCP, so it will give you for the next 10 years protection. Just imagine the benefit of OCP. You understand?
Yes. Thank you very much. And any relation with perimenopause and allergy and like that?
Allergy and perimenopause, there is no relation as such, that allergies will increase with menopause. It is not like that. But, as I told you, that there are so many hormonal changes during menopause. The patient is already very anxious, and anxiety is there. And, the steroids, these hormones are actually steroids. They are steroidal hormones. And the steroids give you a feeling of well-being. So whenever the steroidal hormones will decrease, you will get a feeling of not feeling well. You understand?
Yes.
So having an allergy is not in any relationship with having menopause or being perimenopause. It is just coincidental that you are having an allergic response also. But yes, steroidal hormones as such, decrease in steroidal hormones will give you a feeling of unhappiness or feeling of, something not very good in your body.
Okay. Okay. Thank you. Very nice
Hello,
information.
ma'am.
Anything?
Thank you.
Hello, ma'am.
Yes.
Yes, my name is Jayashree.
Okay.
Hello, doctor. Can you
Yes,
hear
hello,
me?
dear. Yes, I can
Can
hear
you hear?
you.
Yeah,
I'm not sure whether you can see me or not, but I can read many lot of
I'm
messages.
watching you. I'm watching you, but I'm not dressed up, so I'm just I'll switch off my camera.
Okay, no problem. You can,
Yeah.
confidentiality is your right.
Yes.
Okay.
So my small question is, my daughter has matured last year, but she's not
Okay.
having a regular period.
Periods.
Now, what is that?
What age? What is her
She's
age?
right now in ninth, 14 years.
See, whenever there is a menarche, that is when menses start, then immediately the periods will not become regular, because it will take about 6 months to 1 year for the periods to become regular. So you should not get much hustle, and it's a appropriate age for her. Generally, people are getting periods at an early age now, 11 years,
Yes,
10 years.
yes,
And
yes,
for her, I think it's a good age that at 14 years she's got her periods. She must have gained good height also, I believe.
yes,
So
yes.
it's a good thing. And just observe her for the next 1.5 year to 2 years. By the time
Okay,
she's 16 years, she should have good secondary sexual development, as well as she
okay,
should have regularity in her periods. If her
okay,
periods are still not regular, then we will see her hormone assays. We'll see whether her LH and FSH hormones are okay, whether she's suffering from polycystic ovary syndrome or not. Then
okay,
we will worry. Right now, you
okay.
need not worry. Just
Thank you.
observe for some.
Sure, sure. Thank you. Thank you so much, ma'am.
Okay. Anything pertaining to
Hi,
menopause or
hi, Dr.
hello, hi.
Preeti. Dr.
Yes,
Balamma
doctor.
here.
Yes.
Nice.
Good evening.
Good evening. Nice talk, and then nice to see you on the screen.
Thank you.
Okay, very nice. And in
Listen.
1 hour, yeah, very difficult to cover all these topics in 1 hour, but it's
How
enough.
was it?
This is enough. Yeah, it's nice. It's nice. It's nice. I just want to just one suggestion. Please brief about um, calcium and bisphosphonates in menopause.
Okay. Yes.
Because that part,
I will do
yeah,
that,
that part, yeah, because some
yes.
people are
Yes,
still taking, still taking, but some people are still taking bisphosphonates. So they might be having some doubts about this. Fosamax and all available in the market, in the pharmacy.
Yes.
So
Yes,
just
bone
please
density.
comment, yeah, give some brief
Yes.
idea to them. Thank you.
Yes.
Sorry.
Yes,
Okay.
ma'am. I will. Yes, ma'am. It's a good suggestion. I will just put a word about it, ma'am.
Okay. Thank you.
Thank you so much. So actually, Dr. Balama is one of my senior colleagues in Oman, and she brought about this point that in menopause, generally the bone density decreases. So people generally have osteoporosis. So when osteoporosis is there, generally we give calcium and we give vitamins, vitamin D and calcium. Then also it doesn't help most of the time. Then we have to give bisphosphonates when it is refractory and it is not getting affected by anything. Then only then bisphosphonates are given. But you need not take any normal person with little bit of osteopenia, osteoporosis need not take bisphosphonate. Only when it is refractory, then they have to take. But it is very effective. It can be taken. If anything, ma'am, if you have to add, please add, ma'am. Dr. Balama.
No, Preeti, you told enough. Just briefly for them. And usually this bisphosphonates, so if you take for 5 years, that is enough. Not more than 5 years.
Yes.
And
So
there are certain things while taking bisphosphonates, they should be taken in the morning, before breakfast, before coffee, on empty stomach. And they should be in the standing position for about half an hour. They do not sleep or lying down position, that they should avoid. So this
gastritis, yes, because of gastritis.
Reflux esophagitis and all it may cause. Okay, okay, Preeti.
Thank you. Thank you
Yes,
so much.
I disturbed you. Okay.
No. It's a pleasure, ma'am. It's an information for others. Very good. Thank you so
Good,
much,
good.
ma'am. Thank you.
Nice, nice. This vaccine is available in your Alrafa? The Naina was asking, no,
ma'am.
HPV?
Yes. It is available, ma'am. It is available.
Ah, okay. Nice.
Thank you, ma'am. Thank you. Okay. So, anything?
Is any question is there?
One thing I would like to say.
Yes, doctor.
HRT hormone replacement therapy is good for vasomotor symptoms, and it is also good for osteoporosis. But only we have to be very careful about choosing the patients in which we give HRT. That is what. So people who want to take HRT, they should take good suggestion from their doctors before they start upon it for osteoporosis. Osteoporosis, you all understand. Now all of you are doing calcium estimation, vitamin D estimation. But the thing is that no need for estimations. We all are going to be osteopenic and osteoporotic. So exposure to sunlight is the cheapest and the most important thing. And exercising, because the weight exercises are the most important, for the bones. And supplementation of the diet by calcium and vitamin and vitamin you get from the sun. This is what? For your bone health. Anything else?
Yes, Dr. Preeti, I just kept a message in the chat. Exercising in the reproductive age group, I mean, younger age group is like keeping your money in the bank.
Yes.
So the money you can withdraw after retirement. So same way, those who are with good bone strength in the normal age group, those will be doing better after the menopause. So less likely to go for osteoporotic
I told
fractures.
them. I told them that they should not go for high impact exercises, but they should go for low impact exercises who have never exercised before, like swimming and swift brisk walking and running. But and cycling is better rather than running on treadmills, because they will be spoiling their knees. So cycling, sitting position cycling is better for their knees. And swimming is a very good thing. If they can learn swimming at this age, very good. Anything, anybody else? I will just see if any question has come up. And then otherwise we will say bye-bye and happy exercising and happy obesity fighting and sugar controlling to everyone.
And happy Women's Day.
Yes, happy Women's Day.
Today is Women's Day, I think.
Tomorrow, ma'am. Tomorrow.
Okay.
Tomorrow. I think it's okay. Nobody wants to ask anything.
Thank you, Dr. Preeti. I think questions are over. And if anyone wants, they can ask you personally also. Your number is given to all. And they can ask you. Hopefully, you will be not minding it.
Not at all. It's my pleasure and I will be very happy. Anytime anybody can message me, I will be happy to reply back. Whenever I'm free, I'll reply back.
Thank you so much.
Thank you so much. Thank you for bearing with me with such a long presentation. Thanks.
I would like to express my thanks on behalf of the Executive Committee of Indian Social Club Sohar to His Majesty Sultan Haitham bin Tariq Al Said, the Government of Oman, for supporting the Indian community in Oman. I would like to thank our sponsors of the event, Mazun Dairy, Jazeera Steel, Byju's, Shamal Plastics, Live Sure, and our media support, Muscat Daily. Thanks to Aster Al Rafa. Thank you so much, Dr. Preeti Shukla, for giving your valuable guidance and time. Thank you for this nice interaction. Thanks all the members of the Indian Social Club Sohar for their support towards the club and seeking the same in the future. Last but not the least, thanks to all the viewers and attendees for making this event a success. I would like to request all of you who have not yet taken membership of the club to become member and support the club to progress and continue working for giving the service to Indian community in Sohar. If I missed any name, it is not intentional. Thank you once again to you all. Good night, Shubharatri, and Shabba Khair. And now, Mr. Rajesh, the president of the Indian Social Club Sohar, wants to share a few words.
Thank you, Dr. Preeti, for nice interaction. I was out, I am not here. And thank you, Dr. Balamagaru, so for your valuable suggestions also. Well taken.
Thank you, sir. Welcome.
Yeah. Now I have two, three announcements to be done. We are organizing next Friday on 22nd a quiz competition. So I would like we'll send the circular to everybody in the groups and by mail. So please register yourselves, and maximum 30 participants only we are allowing due to our social distancing and COVID pandemic situations. Depends on 50% of occupants. And as already Sonali told, please become a member of Indian Social Club to support us and to organize so many events like this. The next session will be in the next month. Maybe it will be regarding to the dental subject. And I am seeing the enthusiastic participations today also. And I request everybody to inform all, not only what we are sending, you can also circulate in your groups. Not only we are having also on YouTube, so you can watch in the YouTube also. So if any questions you want to ask, you can have Dr. Preeti number, you can do it, or you can send it to Indian Social Club. We will also circulate to her. Thank you very much for taking so much of patience and listening and getting good knowledge about the health issues. Thank you very much once again, and good night.
Rajesh Garu, are you keeping quiz on menopause and gynecological cancers?
Yes, ma'am, definitely. Why not on totally one on medical? Definitely. Yes, sure. We want all your supports also to organize all these things. So definitely we will have one quiz.
Sure.
Yes, sure. We'll try to have. Right. Thank you. Anybody wants to ask anything to Indian Social Club or any suggestions? I'll wait for 1 minute, then I will close the session today. Thank you very much. Fine.